Yes. So I want to welcome everybody to the Summer 2020 Workshop Final Briefings. What we're going to be doing today is in 10 minutes, 5 groups will be explaining first their exploration of the science of a distinct environmental problem and of the solution to that problem, the framing of a piece of legislation to address it. They will have spent the summer working in groups together with deadlines and learning how to produce this kind of report that we're going to hear about today, and that very soon will be on the program's website. This class had the unusual challenge of learning how to build team camaraderie and teamwork in cyberspace. I think we all learned a lot about how to work in this medium. There are certainly a lot of advantages to it, but there are, of course, some disadvantages. Next semester, some of us hopefully will be meeting face-to-face, at least in the individual parts. What we do next semester is we will be moving on to pretending these bills have been passed, and on January 1st, we have to implement them. So that's what we're doing in the workshop. The reports and the briefings that I've seen so far this summer have been extraordinary. And so without further delay, let me introduce our first presenter, who will be talking about advancing emergency preparedness through the One Health Act of 2019, which is a group advised by Professor Louise Rosen. And so I'd like to introduce Russ Kuhner to speak to you. Okay, Russ, unmute yourself, please. And tell me how to pronounce your last name.
Kuhner is good. K-U-H-N-E-R. Yeah, there used to be an umlaut over the U. It's German, but we had a hard time finding work in this country in the early days. You know, it said work for hire in the windows, no Germans. So we anglicized the pronunciation.
Well, every immigrant group has that experience here. So some even worse. So let's begin.
You got it. Stephanie, do I have, I'm controlling you.
Control, so you can practice moving it to the next slide.
All right, so I clicked the screen. All right, I think we're good. And I'm ready to go. I can begin. Good morning, everyone. My name is Russ Kuhner. I'm excited to be here sharing with you my team's work this summer on the Advancing Emergency Preparedness through the One Health Act of 2019, also known as HR 3771. But first, I'd like to thank my team for all of their hard work to help us to get to this point, as well as I'd like to thank our faculty advisor, Professor Rosen, for all of her support. Let's see, clicking, Stephanie.
Hang on one second. All right, try again now. Okay, there you go.
Here we go. I'll begin with a brief introduction to zoonosis in the United States, and then cover the science behind this environmental problem. I'll introduce our bill and the One Health framework, and go on to detail the solutions the bill proposes. I'll outline several stakeholder controversies, and wrap up with conclusion. In 1981, I was born into a world where a zoonotic disease epidemic was getting underway in the United States. This disease was HIV. Infections peaked at 150,000 cases in the mid-'80s, and over 20 years, it killed over 450,000 Americans. As of 2019, annual federal funding for HIV in the United States is about $28 billion. Now, noting that COVID-19 is easier to contract than HIV, it is staggering that today, the COVID-19 pandemic has killed nearly 160,000 Americans in less than a year. The US is currently leading the number of COVID deaths at around 23% of the world's total. As of April, the US government has spent more than $6 trillion to fight the coronavirus crisis, and 40 million Americans have applied for unemployment. The CDC estimates that zoonosis account for 75% of emerging infectious diseases, With the rising contact between humans and animals, that percentage is only expected to grow. The main drivers of this growth are human-caused. Urbanization and deforestation remove natural physical barriers between humans and pathogen-carrying wildlife. For example, deer lose their natural homes. They move into urbanized areas, bringing ticks that carry Lyme disease with them. The livestock and wild animal trade place humans and animals in direct contact, directly exposing people to pathogens, as we saw with swine flu, H1N1. And climate change can create favorable conditions for vector-spread zoonotics like malaria to expand by increasing warm and wet environments that are excellent places for mosquitoes to breed. For pathogens to make the jump between an infected animal and a human, they have to overcome three barriers. The interspecies barrier, which is the initial exposure between an infected animal and a human. The intrahuman barrier, where the pathogen is able to infect an individual and multiply. And finally, the interhuman barrier, which means the pathogen can now be transmitted throughout the population. Now, to reduce the likelihood of this jump occurring, the human drivers that are making this more likely require monitoring. The complexity and scale of this public health crisis requires the efforts of multiple government agencies to address not only human health, but animal and environmental health as well. And that's where HR 3771 comes in. The Advancing Emergency Preparedness through One Health Act was introduced in the House in July 2019. The goal was to advance federal efforts to prevent, prepare, and respond to zoonotic disease outbreaks using a One Health framework. This framework recognizes that human, animal, and environmental health are interrelated and promotes collaboration across various sectors and disciplines to help solve global health challenges. But One Health isn't a new idea. Health professionals have long understood that human, animal, and environmental health must be evaluated together, or vital information is lost. In the case of emerging pathogens, this inhibits prevention and delays response. With the One Health framework, this bill specifically promotes interagency coordination and expands partnerships and capacity to respond to public health threats that can cause major impacts to the economy, agricultural sector, and national security. Unlike PREDICT, a zoonotic disease program that was launched by USAID and mainly run with non-federal partners, this framework instead is a more inclusive effort that requires coordination between many relevant federal agencies and outside partners, expanding capacity to achieve identified goals within a 10-year timeframe. Under the Secretaries of Health and Human Services and Department of Agriculture, this bill directs agencies to identify and build upon existing and past efforts like PREDICT that investigate priority zoonotics and their transmission. By collaborating across departments and disciplines, agencies like the CDC and FDA, who work on similar goals like health monitoring and vaccine development, can also share data to compare progress and accelerate prevention protocols. Agencies will also lead workforce development activities to improve on-the-ground response. Indicators of success for monitoring animal health include early detection of pathogens to promote reductions in both disease spread within animal populations, but also reduce mortality rates. Ongoing domestic and international monitoring of livestock and species within the wildlife trade is essential for early detection of zoonotic disease. In 2014-2015, the avian influenza outbreak in the United States led to the culling of nearly 50 million birds, a loss of $3.3 billion for the poultry industry. In this case, pathogen screening of domestic livestock carried out by the U.S. Department of Agriculture would greatly reduce animal mortality. Satellite monitoring of land use change is used to map and predict the emergence of infectious disease hotspots. These efforts help direct the application of wildlife health monitoring for early detection, and it can also be used to coordinate with local governments to mitigate deforestation, to help stabilize the environmental health of a region. International monitoring of both environmental and wildlife health, in this case, would be carried out by USAID. Providing early and sufficient testing capacity and contact tracing greatly limits the spread of pathogens. South Korea, a country with an existing disease response network, was able to ramp up testing capacity to 10,000 tests a day within a month of government officials coordinating to have testing kits developed. 2 months later, South Korea saw its first day with no new COVID-19 diagnoses. Here in the US, testing kit development and monitoring guidance is directed by the CDC. The complexities of preventing and responding effectively to emerging zoonotic pathogens poses diverse challenges. The keys to early detection and contact tracing requires the collection and sharing of health data. The One Health bill calls for data sharing between federal agencies and global partners to monitor pandemic susceptibility of zoonoses. Some countries, agencies, or even individuals may be uncooperative due to proprietary or privacy concerns. In the US, for example, the Health Insurance Portability and Accountability Act, also known as HIPAA, is a potential barrier to collecting surveillance data on a national level, as South Korea did to successfully respond to COVID-19. HR 3771's One Health framework does not specifically consider the social dimensions that affect human, wildlife, and environmental health. For example, some people are dependent on bushmeat for their livelihoods or as their main source of protein, while others may believe it is to be a healthier option than livestock. All these people would be adversely affected if bushmeat practices were banned. An incomplete understanding of the cultural, economic dependence on the wildlife trade, agricultural practices, and hunting activities, as well as the absence of appropriate alternatives, can lead to unsustainable and inefficient One Health protocols that hinder progress. While there are many challenges that need to be considered and addressed, the One Health framework has the flexibility and adaptability to greatly lessen both the direct and indirect public burdens of zoonotic disease. In summary, the number and frequency of zoonotic disease outbreaks are on the rise. Monitoring for emerging diseases will help the US will move away from merely reacting to outbreaks as they occur and move towards preventing them in the first place. To address the scope of the interconnectedness between humans, animals, and environmental health, a collaborative One Health approach is needed to help keep Americans safe. By facilitating prevention and early detection at the human, animal, and environmental interface, HR 3771 can help proactively reduce disease burdens, financial costs, and societal disruptions. Just imagine where we could be if this bill had been in place before the COVID-19 outbreak here in our country and across the world. Thank you. I'd be happy to take your questions.
Okay, do we have any questions? And yeah, very nice job, Russ. Stephanie, how are we doing question and answers in this format?
Yes, so you can either raise your hand and I can unmute you, or you can type it into the Q&A box or the chat box. So we'll give people a few moments to do either of those.
Okay.
All right, I'm not seeing any, so I think we can.
Okay, well, then it looks like, Russ, you got off easy today. So congratulations and very nice work. And so we'll now move on to our